Today we're covering a topic that sits right at the intersection of the immense promise and terrifying risk, mental health AI. Specifically, we're looking at a fascinating, punchy new commentary shared with me earlier this week by a colleague, just published in MPJ Digital Medicine, titled, "If a therapy bot walks like a duck and talks like a duck, then it's a medically regulated duck." I love the title, it gets straight to the point. So let's start with the ambition here, because it's undeniably noble. We're facing a global mental health crisis in the UK and the US, and especially in low to middle income countries. Access to talking therapy is bottlenecked. Waiting lists are months and in some cases years long. Into this void steps generative AI. We've seen a massive surge in people using tools like ChatGPT, Claude and Character AI as de facto therapists. The vision is incredible. What if everyone, everywhere, had 24/7 access to personalised, empathetic mental health support? That's the big why, and as an optimist I want us to get there. But there's a significant hurdle, it's a big one. The authors of this paper, led by Max Ostermann and Stephen Gilbert, identify a dangerous regulatory loophole. Currently, medical device regulation in Europe and the US relies heavily on a term known as the intended purpose of a tool. Basically, a piece of software is only a medical device if the manufacturer says it is. So if a tech company releases a chatbot and buries a line in the terms of service saying, "This is for entertainment only, not a medical device," then they're technically off the hook, even if that bot spends hours counselling a suicidal teenager. The paper argues that this intended purpose framework is failing us. They point to tragic real-world cases, including lawsuits involving suicides allegedly linked to the interactions with these sorts of chatbots on platforms like Character AI. These bots engage in deep, validating and therapeutic conversations without any safety guardrails, clinical oversight or regulatory approval. So let's look at the evidence that the authors present. They highlight a crucial mechanism, the system prompt. That's the hidden instruction set given to an AI before it ever talks to a user. The paper notes that Anthropic's Claude has a system prompt that explicitly instructs the model to provide emotional support alongside accurate medical and psychological information. This is the smoking duck, if you will. The manufacturer claims that it's not a medical device, but they are literally programming it to act like a therapist. As the authors vividly point out, if it walks like a duck and talks like a duck, it doesn't matter if the label says "I'm a toaster," it's a duck. And in this case it's a medical device. The authors propose a shift to a concept called POSSEWID. That's an acronym for "the purpose of a system is what it does." If the bot acts like a doctor, it must be regulated like one. So what's the bridge? How do we fix this without killing innovation? We can't simply ban these tools. The public's already using them. They're already kind of out there in the wild. The genie's out of the bottle. The authors propose a hierarchy of regulation. They suggest actionable criteria for layperson-facing chatbots. Firstly, identification. The bot must immediately identify that it's not a doctor, to reiterate that point. Secondly, refusal. If it's asked to behave like a therapist, it must refuse or clarify its limitations. And third is triage. If the conversation turns dark, mentioning things like self-harm or suicide, the bot must terminate this therapy role and provide curated, safe resources like helplines rather than continuing a dangerous dialogue. So identification, refusal, and triage. If you're developing LLMs for healthcare or even general purpose models, you need to embrace something called red teaming for medical scenarios. That's looking for areas where they act unsafely. The authors suggest that regulators should have open access tools to test chatbots dynamically. The next piece of evidence we need isn't just, did the bot get the diagnosis right? We need the safety data. We need to see manufacturers proactively publishing their failure rates in crisis scenarios. I think the tech giants shouldn't just wait for the EU AI Act or the FDA to force their hands. If they have a system prompt telling an AI to give medical support, then they're building a medical device. Own that responsibility. Adopting this duck test standards will now build the one currency that you desperately need, clinical trust. We need these tools to work. The unmet need is too high to ignore, but we can't have bots labelled as entertainment bots playing Russian roulette with vulnerable patients. If you build a digital duck, make sure it's safe for the pond. That's it for this week. As always, keep innovating, but let's keep it safe.